I think we are ready. Okay. It's SVI Media at Star Valley Medical Center once again today, and we are with Trevor Spencer, cardio echogram tech at Cardiac Rehabilitation Clinic at the Medical Center, and it's Heart Health Awareness Month, if I understand, Trevor. So tell us a little bit about what the Cardiac Rehabilitation Clinic does at the Medical Center and how it all ties in with healthy hearts.
Perfect. So Cardiac Rehab is a program that helps patients who have had heart problems, either heart attacks or heart surgery of some sort, get back to a full functioning way of life or get back to doing the things that they like to do. And so we help people through not only exercise, but diet, nutrition, and some psychosocial counseling that might be needed or other resources that we have available to us to help those people, get back to doing the things they love to do and get back to feeling normal. As you might imagine, having heart problems or having heart surgery is a big deal, is a big life-changing event in these people's lives. And so the cardiac rehab kind of helps people get over that hump and get back to feeling normal and feeling healthy again.
So at what point does someone come into to cardiac rehab and get rehabilitation? Is it after a heart attack, or are there other life-changing events, or is it something that can sometimes just sneak up on people? How do people know that they need cardiac help?
So to be enrolled in a cardiac rehab program, you actually have to have a referral from a physician. It doesn't have to be a cardiologist, but oftentimes it is a cardiologist that will refer somebody to a cardiac rehab program. But it's anybody who has a low functioning heart is one of the criteria. Anybody who's had a heart attack, anybody who's had any sort of valve surgery, anybody who's had stents placed. Maybe they haven't gotten to the point of a heart attack yet, but they found it early enough and were able to open those blockages in their heart. Those people all qualify for cardiac rehab. And like I said, it's all done on a referral basis from a physician.
Tell us about some of the other physicians that you have that work in cardiac rehab other than yourself, and tell us what they do.
Great. So our medical director here in cardiac rehab is actually Dr. Larry Green, who's a cardiologist that comes to our medical center once a month. And he kind of oversees the program. He helps us to, determine the course of treatment and things for the patients that come in here. And he also sees patients on a general cardiology basis as well. So, anybody who has heart problems can be referred to Dr. Green. His affiliation or his association is with the University of Utah. We also have Dr. John Lassiter, who comes over from Eastern Idaho Regional Medical Center, who also sees cardiology patients here, again, coming once a month. They kind of alternate, so there usually is a cardiologist here about every 2 weeks. We have a couple of different cardiologists that come up on an as-needed basis, one of those being Dr. Roger Friedman, who comes up a couple times a year to check pacemakers and defibrillators, things like that. And there's, they bring an assortment of people with them.
So what should someone expect as they get enrolled in this program? Kind of what are some of the steps you walk through with them early, and what's the overall goal?
So the goal of a cardiac rehab program, like I mentioned, is to get people active and to get people healthy, to maybe change a lifestyle a little bit in order to get people to do the things that they want to do again. So when somebody is enrolled, we have them exercise and slowly at first, and we have a home program that we walk them through as well. But we also have classes. We offer education classes at least once a week. We offer people, because it is tailored to an individual, so we don't force anything on anybody, but we offer to let people meet with a dietitian, to let people meet with a counselor, to let people meet with a pharmacist. There's lots of medications that are new to people, and so if they have questions about those, so the program is really tailored to the individual, so there really isn't maybe necessarily one track that people follow, but kind of the underlying theme is that we will make them exercise, we will get them moving, and then we do have all these other resources that are available to the patients.
Now understand, because it is Heart Health Awareness Month, you do have an event up and coming. Tell us a little bit about that.
We do. The hospital here is sponsoring a Heart Healthy Luncheon. It's going to be on Wednesday, February 15th at 12 p.m. in the Grays River Room here at the hospital. The public is welcome and invited to come and attend. There'll be different presentations from some people who know a little bit about heart health, and you can ask questions and just get some information about how to maybe have a healthier lifestyle, help your heart out a little bit.
Trevor, thanks so much. Anything else about the rehab program you wanted to mention today?
Nope. I think we've covered it pretty well. I would encourage anybody who might be in that boat that have had some heart issues to talk to their doctor and get enrolled.
Trevor Spencer at Star Valley Medical Center.